Have you started noticing changes in yourself that feel embarrassing or concerning? Maybe you're keeping more things than you used to, saying things that surprise even you, or struggling with habits that once came naturally. I want you to take a deep breath right now, because you're not alone, and you're definitely not losing it. These changes are more common than anyone talks about, and understanding them can help you navigate this stage of life with confidence and dignity. As we age, our bodies and minds change in ways that nobody prepared us for. Some of these changes can feel uncomfortable or even shameful. But here's the thing, when you understand what's happening and why, you can take back some control and know when to seek help versus when to simply adapt. Today, we're going to honestly discuss 12 changes that many of us experience but rarely talk about openly. By the end of this video, you'll understand what's normal, what might need attention, and how to maintain your dignity and independence through it all. If you've been wondering whether the changes you're experiencing are normal, or if you want honest information about aging, comment, "Tell me more," below. And if you're tired of being told to age gracefully without anyone explaining what that actually means, subscribe to Elderly Health Central. We talk about the real stuff here. The things your doctor doesn't have time to explain and your family doesn't know how to discuss. So let's dive into that straight talk right now. I'm going to start with something that might sound familiar to many of you. Number 1, saying things you wouldn't have said before. You might catch yourself making comments about people's appearance, asking personal questions you wouldn't have asked before, or sharing opinions more bluntly than you used to. Let me tell you about Beverly. She recently said to her postal worker, "That uniform really doesn't flatter you at all." Her family was mortified, but the words just came out before she could stop them. Now, the part of our brain that acts as a filter between thoughts and speech, that's called the prefrontal cortex, can change as we age. This isn't about becoming rude. It's about your brain working differently than it used to. Some medications can also reduce our inhibitions, making this even more likely. You might feel embarrassed or think you're becoming a mean person. That's not true. This is a normal part of aging for many people. Your family might think you're doing it on purpose, but it's often completely unintentional. So try pausing for a moment before speaking in social situations. If you catch yourself after saying something, a simple "that came out wrong" can help. And please, don't be too hard on yourself. Your intention is still good. Changes in how we express ourselves can extend to very personal matters that we once handled privately. Number 2, having more bathroom urgency and accidents. Kenneth used to plan road trips without thinking twice about restrooms. Now he announces to everyone, "I need to find a bathroom right now," and has even had a few accidents that left him embarrassed and afraid to leave home. You might find yourself timing everything around bathroom availability. Here's what's happening. Bladder muscles naturally weaken with age, prostates change in men, and many medications affect bladder control. This affects up to 40% of seniors, but it's rarely discussed openly, leaving many people feeling alone and ashamed. You might think this means you're falling apart or that nothing can help. Many people start avoiding social activities rather than risk embarrassment, but isolation isn't the answer. Pelvic floor exercises really work when done consistently. Schedule bathroom breaks every hour when you're out. Talk to your doctor, there are medications and treatments that can help significantly. Don't let embarrassment keep you homebound. When bathroom needs become unpredictable, you might find yourself needing more control over other aspects of your daily routine. Number 3, becoming more rigid about your routines. Patricia insists on washing dishes by hand despite having a perfectly good dishwasher. When her daughter suggests using it, Patricia's response is always, "I've been doing dishes this way for 60 years. You might find yourself refusing suggestions for easier ways to do things, preferring your established methods. When so many aspects of life feel unpredictable or beyond control, routines become anchors that provide comfort and security. Brain changes can also make adapting to new information more mentally taxing, so sticking to familiar patterns actually conserves cognitive energy. Family members often see this as just being difficult or stubborn. You might feel defensive when people suggest changes, thinking they don't respect your experience or intelligence. Honor your need for routine while staying open to safety improvements. Choose your battles. Keep routines that comfort you, but consider changes that prevent falls or injuries. Explain to family why certain routines matter to you. Sometimes this need for control extends beyond routines to how we view the people around us. Number 4. Becoming more suspicious of others' motives. Gary recently accused his neighbor of stealing his newspaper and is convinced telemarketers are specifically targeting him. He's installed multiple locks and questions everyone's intentions. You might find yourself wondering if people are trying to take advantage of you, or if situations that once seemed normal now feel suspicious. Increased awareness of our vulnerability, combined with media reports about elder scams, creates a foundation for reasonable caution. However, hearing loss that makes conversations confusing and mild cognitive changes can amplify these concerns into excessive suspicion. Family might worry you're developing paranoia or dementia, but some suspicion is actually protective. The key is distinguishing between reasonable caution and overwhelming worry that isolates you from helpful people. Stay socially connected with trusted friends and family. Verify concerns calmly with multiple sources. If your suspicions are significantly impacting your relationships or daily life, discuss this with your doctor. When trust becomes difficult, you might start holding onto physical things more tightly for security. Number 5. Keeping more things than you used to. Diane's kitchen counters are disappearing under stacks of newspapers, empty containers, and items that might be useful someday. She gets upset when family suggests clearing things out because these items represent security. You might find yourself saving things you once would have thrown away. As we age, decision-making can become more difficult, and we may feel more anxious about waste or future needs. This isn't a character flaw. It's often your brain trying to feel prepared and secure during uncertain times. Depression and anxiety can amplify this tendency. Many people feel ashamed of this tendency and try to hide it from family, or they get defensive when others want to clean house. Your family might call it hoarding, but you know these things could be important. Try the 1-year rule. If you haven't used something in a year, consider donating it. Start with one small area and focus on keeping pathways clear for safety. Ask a trusted friend to help you sort through items without judgment. When organizing belongings becomes overwhelming, other aspects of daily care can start to feel challenging too. Number 6. Struggling with personal care routines. Donald's once impeccable grooming has become hit or miss. Some days his hair isn't combed, his clothes have stains, and he seems less concerned about his appearance. Maybe showering feels more exhausting than it used to, or you don't notice body odor the way you once did. Aging can affect our sense of smell, making it harder to detect when we need to bathe. Arthritis, balance issues, or fatigue can make hygiene tasks physically challenging. Depression or medication side effects can also reduce motivation for self-care. You might think you're being lazy or that others are being too picky about cleanliness. Your family might worry you're giving up, but neither perspective captures what's really happening. You're adapting to physical and sensory changes. Consider shower aids like grab bars or a shower chair if standing is difficult. Set gentle reminders for hygiene tasks. If you can't smell well, ask a trusted person to help you maintain your standards. Address any underlying depression with your doctor. Just as personal care can become challenging, you might also find your conversations focusing more on problems than positives. Number 7. Complaining more about daily life. Brenda finds that every conversation seems to center on her aches, pains, and complaints about how things aren't what they used to be. You might notice that your discussions with family and friends increasingly focus on what's wrong rather than what's going well. Chronic pain, loss of independence, grief over changes, and social isolation can increase focus on negative experiences. Complaining is often a way of seeking connection, validation, or help with real struggles that are affecting your daily life. You might feel guilty about being negative all the time, or your family might think you're just naturally becoming grumpier. In reality, you're processing genuine losses and seeking understanding for legitimate challenges. Acknowledge your struggles while also sharing one positive thing each day with family. Set gentle boundaries on complaint time, allow yourself to vent, then consciously shift to other topics. Consider counseling if negativity is overwhelming your relationships. Sometimes focusing on our own struggles can make it harder to remember details about others' lives. Number 8. Having memory lapses that affect relationships. Linda keeps asking her son the same questions about his job and retelling the same childhood stories during every phone call. Her family feels unheard, while Linda feels confused about why they seem frustrated. You might find yourself repeating stories or forgetting recent conversations. Normal age-related memory changes affect recent memory more than distant memories. Short-term memory naturally becomes less reliable with age, while long-term memories often remain vivid. Stress, medications, and health conditions can worsen these changes. You might worry that any memory problem means dementia, or your family might assume you're not listening to them. Most memory changes are normal aging, not disease, but they still affect relationships. Use memory aids like calendars, notebooks, and phone reminders. Be patient with yourself and ask family to be patient too. Establish routines that help you remember important information. Know when to seek medical evaluation for concerning changes. When memory becomes unreliable, you might find yourself focusing more intensely on your own immediate needs. Number 9. Becoming more focused on your own needs. James finds that conversations increasingly center around his doctor appointments, his medication side effects, and his concerns about the future. Family gatherings seem to revolve around his needs, leaving others feeling overlooked. You might notice you interrupt others to discuss your own concerns. When you're managing multiple health issues, complex medication schedules, and processing your own mortality, it becomes genuinely difficult to focus mental energy on other people's day-to-day concerns. This isn't selfishness. It's cognitive prioritization during challenging times. You might feel guilty about being selfish, or your family might think you don't care about their lives anymore. In reality, you're managing an increasingly complex set of personal challenges that require constant attention. Make conscious efforts to ask others about their lives, even if briefly. Schedule specific times to discuss your health concerns rather than bringing them up constantly. Explain to family that your focus on health issues isn't lack of interest in them. This intense focus on personal needs often extends to fiercely protecting your remaining independence. Number 10. Defending your independence even when it's risky. Harold continues driving despite 2 recent fender benders and family concerns about his reaction time. When anyone suggests limiting his driving, he gets angry and defensive. You might find yourself insisting on doing things alone even when accepting help would be safer or easier. Independence represents identity, competence, and freedom. When so many capabilities have been lost or restricted, defending the remaining ones becomes about preserving your sense of self rather than just completing tasks. Giving up independence feels like losing who you are. Family might see this as dangerous stubbornness or denial, while you see it as maintaining your dignity and value as a person. Both perspectives have validity, but safety and identity needs must be balanced. Look for compromises that preserve some independence while addressing safety concerns. Consider gradual transitions rather than complete stops. Explore alternatives that maintain your autonomy in different ways. Communicate your fears about dependency to help family understand your perspective. Sometimes the effort to maintain independence extends to continuing complex tasks even when they become more difficult. Number 11. Changing your eating habits and table manners. Carol's elegant dinner parties have given way to standing at the kitchen counter eating finger foods. She seems less concerned about spills on her clothing or using proper utensils. You might find that eating neatly requires more effort than it used to, so you've simplified your approach. Arthritis makes handling silverware painful, vision changes affect precision, and coordination naturally declines with age. Medications can change taste and appetite, while cognitive changes might affect awareness of social eating norms. Family might think you're letting yourself go, or being intentionally sloppy, when you're actually making practical adaptations to physical limitations. The choice isn't between eating nicely and eating sloppily, it's between eating independently and needing help. Consider adaptive utensils designed for easier gripping. Choose clothing that hides stains or is easy to wash. Focus on nutrition and independence over appearance. Use finger foods when they're easier to manage. When daily tasks become more challenging, you might find yourself avoiding social situations altogether. Number 12. Withdrawing from social activities and family gatherings. William used to be the first to arrive at family gatherings, but now he makes excuses to avoid social events and seems content staying home alone. You might find yourself declining invitations not because you don't care, but because participating has become exhausting or embarrassing. Hearing loss makes group conversations difficult, mobility issues make navigating unfamiliar spaces challenging, and fatigue makes long events genuinely exhausting. Social withdrawal is often a practical response to real limitations rather than depression or lack of interest. Family might interpret your declining invitations as depression or not caring about them, when you're actually trying to avoid situations where your limitations might be embarrassing or overwhelming. Communicate your specific challenges to family so they can make accommodations. Suggest shorter visits or quieter gatherings. Accept help with transportation or mobility when offered. Stay connected through phone calls or video chats when in-person visits are too difficult. Here's what I want you to understand: every single one of these changes represents a human being trying to adapt to new realities while maintaining as much dignity and autonomy as possible. These aren't character flaws or moral failings. They're intelligent responses to real challenges. If you're experiencing any of these changes, you're not broken. You're adapting. Your brain and body are doing their best to help you navigate this stage of life. If you're watching someone you love go through these changes, they're not becoming a different person. They're the same person dealing with new circumstances. The goal isn't to prevent these changes or feel ashamed of them. It's to understand them, accommodate them when possible, and respond with compassion rather than judgment, both for yourself and your loved ones. Growing older means navigating changes, but it doesn't mean giving up on quality of life, dignity, or meaningful connections. With awareness, patience, and the right support, we can age with grace, imperfections and all. So here's my question for you: which of these resonated most strongly? Are you the person experiencing these changes, or are you watching someone you love go through them? Understanding your perspective changes everything about how you move forward. Share in the comments, not just which behaviors you've noticed, but how this new understanding might change your response. Your insight could be exactly what someone else needs to hear today. If this conversation helped you see aging differently, I'd love for you to subscribe to Elderly Health Central for more honest discussions like this one. We're building a community where these realities can be discussed without shame, where adaptation is recognized as strength, and where the full spectrum of aging experiences is honored. Because you deserve a place where your truth is valued, not judged. Thank you for staying with me through this honest exploration. Remember, aging isn't about maintaining perfection. It's about adapting with grace, understanding with compassion, and connecting with truth. I'll see you next time, where we'll continue these important conversations about what it really means to age with dignity.